Hi, my name is Courtney Blake, and I am a fourth-year nursing student at North Island College here in Courtney, BC. I absolutely love nursing, but one thing that I've really noticed about my education is there's a real serious lack of information about training in regards to the health of 2S LGBTQ plus individuals. I see that a lot through my textbooks, through my lectures, and it's something that as a queer woman I'm really passionate about in changing, and that is a passion that I share with my friend here.
Hi, my name's Sam. I'm trans. I'm 23 years old. So I came out when I was 19 years old, and I was super lucky to have a friend group that accepted me. But my family took a little bit longer to come around, and I didn't really have anybody who could help me with the legal process of transitioning or the medical process of transitioning. I had no really guidance in that aspect. So the first thing I did was talk to my GP, who then referred me to an endocrinologist who specialized in hormone replacement therapy for transgender individuals. But there was a really long wait list, which is a super common thing because doctors that specialize in this are very few and far between. So after months of waiting and 2 appointments with the endocrinologist, I finally got my hormones because I knew that I wanted a medical transition that included hormone replacement therapy. So I got my testosterone and I was super excited. The first 3 injections you do have to be in front of a nurse in a doctor's office. So I brought my testosterone to the nurse, who informed me she wasn't comfortable doing these injections and that I needed to come back a different day when a different nurse was on staff. And I was crushed. I was so excited to finally help, progress my medical transition journey, and was met with another wall after another wall. But I did eventually start my hormones. Going to a doctor's office and getting misgendered happened for about 2 years as I was on hormones. So I would have to disclose that I was trans at a doctor's office, even if I wasn't there for something trans-related. I even had a secretary at a walk-in clinic one time ask me if I had a twin by my old name because they couldn't figure it out after 5 minutes of staring at the computer and asking me my date of birth and my first and last name. They couldn't make the connection in their mind that a trans person could have a different name than how they're identifying. And I hadn't legally transitioned yet. Not all situations that I go through where I get misgendered are funny like that. It can be really uncomfortable, and it's not just something I experience. Trans people and non-binary people and gender non-conforming people experience that all the time. After I was on my way with the medical transition process, I began the legal transition process, which involved getting my name changed and my gender marker changed, which cost a lot of money. I had to get a note from my doctor saying that I really was trans. I had to go to the police station and get my fingerprints taken and have them put my old name in a database listed under aliases with a photo and my address. I had to go to a notary to get both of these forms notarized, which I had to pay for. I also had to pay to replace my birth certificate twice and my identification twice because the BC government doesn't have a form for you to change your name and gender marker at the same time. All in all, it ended up costing me around $400. And I really wish these things were the end of troubles that trans people face, but unfortunately, they're not. I have been discriminated against online, in person. I've had slurs shouted at me. I've been shoved out of men's washrooms. I've had people say things under their breath. And I know that unfortunately I'm one of the lucky ones to only have experienced a small amount of physical violence for being trans. In Canada, more than half of trans or non-binary individuals experience gender-based discrimination. And over 1/2 of queer men suffer from depression, anxiety, or loneliness. According to a study conducted by UCLA in 2019, 29% of trans adults live in poverty. And according to the Human Rights Campaign Anti-Trans Violence Study, 40% of homeless youth are LGBTQ. The Human Rights Campaign also keeps track of all of the transgender individuals who have been murdered so far in America this year. And we are at 33 trans people that have been murdered. Last year was 25, and 81% of them were under the age of 30.
There's lots of statistics out there, a lot of numbers that talk about the disparities and inequities that everyone under the 2S LGBTQ+ umbrella faces. Trans individuals face even more so than the rest of us under the umbrella because of their gender identity in addition to their sexual orientation. And that's just it. Every single avenue of life that you can measure, there are disparities. And that's so unacceptable. And it's mind-boggling to me how we can brush that under the rug and ignore it and say, okay, well, 30% of trans folks live in poverty. Well, 70% don't, but how many people who are not trans live in poverty? That number is going to be quite a bit less. And statistics have a funny thing about them where you can change you can alter how they're perceived by looking at them from different lenses. 40% of homeless youth are queer. How many youth, period, are queer? Not 40%, right? And how many homeless people are youth? Not 40%. So when you look at it from all these different lenses, it becomes more and more to the forefront of how devastating these disparities can be. And I see that a lot in my nursing education. I learn about, we talk about something called the social determinants of health. And these are things about your life that impact your health that are not like diseases. So your age, your gender, your sexual orientation, where you live, your income level, your education. All these different parts of your life do have huge impacts on your health and how you live. And when we talk about that, we learn about how the consequences of these can be drastic, and then we don't do anything about them. We just talk about how awful it is and then go, well, I guess we're just gonna, throw some drugs at people, recommend that they exercise and eat right, and that's all we can do. And that's so not true, which is why Sam and I have a vision for a way to address some of these.
So about a year and a half ago, Courtney and I were out for breakfast, and I was talking about the troubles I was having with updating my name change and my gender marker. And I said, if I won the lottery, I would want to make a place that other trans people could go to for help with this sort of thing, because it was a really complicated process, and I'd want to help them with,
With guiding them through that process.
Yeah, I'd want to help them with guiding them through that process. And Courtney said,
why not just do it?
Yeah.
Why wait for a lottery? Why not just do it?
We workshopped it a little bit, and we decided we wanted to make our own nonprofit society, which we did, and we decided to call it Queer Source.
We are officially incorporated as of earlier this year, which is very exciting. We have a board of directors, and we have a logo, and we have social media, which is great. We're just, we have a lot of ideas for what we want this resource to look like. And those ideas are influenced by our backstories, by our histories.
So I'm really hoping to be able to provide resources for 2S LGBTQ plus people online and in person. We're starting with online. I really want to get some guidelines on what it's, how to go about your name change process or your gender marker process, or, where can I find community supports or groups of people like you where you can, have a sense of belonging. But I also want to have supports for parents of trans youth to talk to them about the realities of the situation. Because my family wasn't very accepting at first, but after I started hormones and they saw how much happier I was, they realized they weren't losing a child, they were gaining a happier child.
And that's a common experience among parents. And it's a tricky situation because parents need to mourn the future that they envisioned for their child, but at the same time, they also get to celebrate a new future that they hadn't maybe anticipated. The problem is if you mourn your child in front of them, that can be really dangerous and problematic and really harmful to your child. But this process needs to happen. And so creating a space where parents can do that and talk to people who have been through that process and talk to trans people who have experienced supportive homes and non-supportive homes, and giving them the space to talk about these things without fear of judgment is so critical, because one of the social determinants of health is social support networks. If you don't have a social support network that's going to be there for you during whatever is going on in your life, you're going to have a harder time going through that, and you will see that in your health. My vision for Queer Source, everything that Sam said is so important. I would love to see more of a clinical space as well once we're able to get some funding and get up and going. There's a lot of disparities for all folks under the 2S LGBTQ plus umbrella in terms of sexual health, reproductive health, cancer screening. The education is not provided to healthcare providers about what conversations to have with people, and that leads to misconceptions about what people need to know to maintain good health in their life. Additionally, having a space where you can talk to a healthcare provider and you can disclose your identities, whether it be that you're transgender, whether it be that you're gay, bi, pan, ace, however you identify, feeling safe to tell your healthcare provider about that leads to better health care. And it's the responsibility of healthcare providers to contribute and make sure that that space is safe. And that's what I want. I want to help create a space where people can come in and know that the person who's helping you, the person who's giving you advice, knows what they're talking about, knows queer identities, knows some of the disparities that people face, and not just for youth. One thing that we have both noticed here in the Comox Valley specifically is all the services that exist that are specifically geared towards 2S LGBTQ plus folks is specifically geared towards youth, 30 and under. And that's great. There's a lot of people who fall into that age category that need extra support, especially in your younger youth, your teenage years. There's such an important identity exploration in that stage of your life, and to be able to explore that in safe environments is critical to your health. However, there are so many people who are above 30 who also need support. There's a lot of people who are coming out later in life now because our culture has changed, our society has changed, and it's becoming more acceptable to come out as trans, as gay, as any kind of identity under that umbrella. And so we see people who are coming out in their 60s, in their 70s, in their 80s. And they deserve access to the same resources that an 18-year-old has access to, and right now they don't. And so a large part of what we want to do with QueerSource is to be able to offer these resources to anyone of all ages, of all identities, and get them what they need to make sure that they live a healthy and stigma-free life.
Wow. So QueerSource is currently on Facebook at QueerSource or QueerSource Society, and we are developing a website right now, which is queersource.ca.
We're really excited about this website. It's the first thing that we're going to be able to provide to our community. We're starting off small, and we're going to have some information on there to help connect people to resources that already exist. And then we're hoping that in the future we can write some grants and get some funding and get a space. But that's a bit further down the line. Right now, we're just working on this website.
Yeah, we really want to have an online hub of currently available resources that are nice in a neat little area to be accessible for people in our community.
Yeah.
Yeah, that's it.
So follow us at QueerSource on Facebook, and keep your eyes peeled when the website goes live. We'll be posting it on there, and yeah, we would love to get your feedback about what you think needs to be on there, and what gaps exist currently, and what you think would help you live your best life. So, thank you.
Thanks.